To do a blood glucose check, first of all, I would go into the patient's room, identify the patient with the name, and check their armband for their ID. Then I would perform hand hygiene. Um, I would perform hand hygiene and put on clean gloves and have the patient to perform hand hygiene for themselves. Then I would choose an injection site. Um, First of all, before I do that, I need to turn on the machine and then put on a glucose meter in. And then as that's turning on, I would check the patient, see where we did the glass glucose check. I wouldn't choose the same site, but I would choose a distal finger and on the lateral side. So once I get that, I would clean the patient's finger again, and then I would take the lancet and pierce on the lateral side of the finger. Once I do that, I would take a cotton swab and I would wipe away the first drop of blood. Whenever I lightly squeeze, I get the second drop of blood and I apply the lancet, or not the lancet, the test strip, have that reading. As that's reading, I would put a cotton swab back over the patient's finger to stop the bleeding. Once the results come up, I would explain the results to the patient. After that, I would disinfect the machine and turn it off. I would take my gloves off, perform hand hygiene, again explain the results to the patient, and then go and document the results. For insulin, I would follow a sliding scale, which is that if the glucose is 151 to 200, I would give 2 units of insulin, 201 to 250, 4 units of insulin, 251 to 300, 6 units of insulin, so on and so forth. So with every 50 for blood glucose, I would go up 2 units of insulin.